88th International Virtual Learning Series with the blessing of Almighty, our founder, Kalvi Vallal Deivathiriti Kalasalingam Ayya, and with the support of our chairman, Ilaya Vallal Dr. K. Sridharan sir. I'm here to deliver the welcome address for this 88th International Virtual Learning Series. In association with the Indian Pharmaceutical Association, South Tamil Nadu local branch, head office at Arulmigu Kalasalingam College of Pharmacy. Can you hear Anbu sir? Today I feel very much honored to welcome our eminent personality, notorious researcher, undisputed personality, and honorable resource person, scientist Dr. Veerappan Mani, King Saudi University Science and Technology, Saudi Arabia, to grace this occasion. Let me acquaint you with sterling quality of this eminent personality, who is a well-known researcher. It is a great pleasure for all of us that he could find time to be with us in spite of his busy schedule. Thank you, Dr. Veerappan sir. Thank you, sir, for accepting our invitation and spending your precious time with us.
Thank you.
We are fully appreciate you for finding time to be with us. The busy schedule will students. Most welcome, sir. Dr. Veerappan sir, most welcome, sir.
Yes, yeah. Thank you. Yeah, I'm listening. Yes.
Thank you, sir. It is gratifying to note that this session covered a wide range of interesting topics relating to the variable chemical sensor for healthcare monitoring. So I hope this session will be a good platform for our students. My dear enthusiastic students, kindly utilize this great opportunity to explore your knowledge. This is the first and foremost needed for your career. Next, I extend my sincere thanks to Dr. Rajabandian from Germany for his wonderful arrangement of this 88th International Virtual Learning Series. Thank you, Dr. Rajabandian, sir. Thank you, sir. Next, I welcome all the respected professor, faculty members, and my dear enthusiastic students for today's session. All the very best, my dear students. Once again, I welcome you all. Thank you. Sir, please, you can proceed, sir. Continue your presentation, sir.
Okay. Thank you. But I can't share my video. Can you see my video? How about now? Because my camera is not open. So do I need to open my camera? I think my camera is closed now. Okay. Maybe I stop sharing and start again, if that works. Okay. Yeah, I think now video automatically disappears. Okay. So can you see the screen now? Let me begin. So, good morning, everyone. Thank you for joining with me to listen this webinar organized by this Kalaslingam College of Pharmacy. And I would like to thank my friend Rajbandian who introduced me to this webinar. And I'd also like to thank the organizing committee, the convener, principal, and the management committee for arranging this wonderful webinar series. And I came to know that it is, in fact, 88th webinar series. So which means there were 87 series were completed successfully. So I think this is really a wonderful opportunity and excellent platform for the students to engage even during this pandemic situation. So I'm glad that I'm able to join with this organizing series. So before moving into my scientific talk, let me introduce my campus. So King Abdullah University of Science and Technology, shortly known as KAUST, which is my campus. So KAUST campus is located in Saudi Arabia at the coastal areas of Red Sea. So it's not too far from India. From Bangalore to Jeddah, it's around 4 to 5 hours by air. And from Jeddah to our campus, it's around 2.5 hours by car. And KAUST is around in 2009. The KAUST campus was originally opened in 2009. So it's around 11 years ago. So it's quite young university. The campus is around 8,900 acres. It's quite a large campus. So inside the campus, we have research buildings, housing units, hospitals, convenience stores, schools from kindergarten to high school. So actually, we have all the facilities for the community members who work and study here. So it's quite an interesting place to explore. And KAUST ranked 8th fastest right in the university for it. So is that audible? Ah, okay. So KAUST is ranked 8th fastest rising young universities for its research output, which basically comes from its high quality publications as well as collaborations with big universities all around the world. And KAUST has diverse community. So 70% of people come from international community. So more than 100 national people are working here. And KAUST provide master and PhD program. So in order to get admission in KAUST, you need to have a minimum 3.5 GPA in English proficiency test like TOEFL, IELTS, or TOEIC. So, and one good thing is KAUST provide very good financial support for students, particularly for master and PhD students, like full tuition fee waiver, and they also provide annual stipend of around 20,000 to 30,000 US dollar for PhD students. Plus, housing is free, medical coverage is also free, and plus they also support for annual travel fare and relocation allowance. So it's really a very good package, one of the best package for a PhD candidate to pursue his or her PhD. So you are welcome to apply if you want to do master or PhD in our campus. So currently, KAUST is accepting application for its spring and fall intake. So you can directly go into the website and apply. And in fact, we also have internship programs. So like short-term internship programs, 3 months to 6 months. So if you want to engage in a short-term activity, you can also apply for internship program. So let's move into the scientific talk of today's talk. My content includes, first I introduce the problems in disease diagnostics and what are the routine chemical sensors currently we are using in disease diagnostics, the major chemical and biosensors. And then I move into introduce some wearable sensors, the types of wearable sensors and their advantages and limitations, and what are the methodologies we can use to fabricate such wearable sensors. And then I talk about the role of nanomaterials and what are the technologies currently popular in making these sensors. And then I give some note on personalized medicine, personalized drug, because I think students are from pharmacy, so maybe they are interested in this topic. And finally, give some challenges in this topic and summary of this talk. So broadly, we can classify major diseases into two major categories: chronic diseases and infectious diseases. So chronic diseases are long-term disorders. They persist for more than 6 months or even years, 2 years to 5 years. So this table shows, the left table shows 10 common chronic diseases, and mainly heart diseases, cancer, and diabetes are top three diseases that causes more number of fatalities than other chronic diseases. And one major problem with these chronic diseases is early diagnostics is very challenging. So it don't show signs and symptoms in the early stages. So that's the trouble, and that's why that makes challenging for analytical chemists to design a sensitive technique to develop sensors to early detect these chronic diseases. And on the other side is infectious diseases. These are caused by the pathogenic organisms such as viruses, bacteria, and parasites, and so on. Some of the examples are cholera, HIV, influenza. These are some examples. And the best example to this current scenario is coronavirus. So everybody knows that that also a virus infectious diseases. And infectious diseases are contagious. That's the major problem. They're able to spread from person to person, either directly or indirectly. And it shows signs and symptoms in early stages compared to chronic diseases. And the contagious makes this more more famous over chronic diseases. If we take coronavirus, it transmits from animal to one or few people, then from few people to more people inside the country, and from one country to one continent, and from one continent to all over the world. So now we have millions of cases. So it begins from one person. So that shows the severity of infectious diseases. Okay. So general clinical diagnostics. So clinical diagnostics is a branch of medical field where clinicians collect the sample, analyze it, interpret the data, and get some digital data out of the biochemical data. Then they make a decision. So that's the clinical diagnostic procedure, the routine procedure. So it usually has three major steps. The first step is sample collection step. So the clinician collect the biofluids, either whole blood or saliva, sputum, or other biological fluids. And in the second step, they process the sample, either they do pre-concentration or pre-sampling procedures, and then they go for data generation step using certain analytical methods. Okay, so maybe chemical sensor or biochemical sensors. And then they extract such chemical information and they translate those information into a readable digital data so that doctors can see the data and make a useful decision for the treatment or further analysis. So one interesting thing is 70% of medical decisions are made by laboratory results, which indicating the significance of medical decisions. Significance of these laboratory tests. So these are some examples for portable chemical and biosensor kits commercially available for home healthcare device, also in the hospitals. So malaria kit. So basically these are antibody kits. So they have malaria specific antigen coated on the solid surface. So when a person who infected with malaria, his body produces malaria antibodies in order to fight with malaria antigens. So when we place a patient's sample on the sensing zone, there will be an antibody antigen binding event, and that binding event will be translated into colorimetric signal. And these are qualitative analysis kits, which means they can only tell us yes or no whether a person is infected or not. It don't tell us how severe it is. So in order to know how severe the disease is, we should go for more sensitive techniques like PCR. And here are some examples for chronic disease kits. So the best example is glucose meter. So For to test the amount of glucose present in our blood, just we take a drop of blood, place it on the sensing zone, then we can see the amount of glucose present in our blood. So similarly, we have hormone test kit, cholesterol, uric acid, and so on. And these kits are quantitative because chronic diseases are majorly detected or qualified based on the biomarkers present in our biofluids. We need to have a quantitative data, and so that we can compare with the physiological levels, and if any deviation from physiological level, then we can get some information about the chronic diseases. Okay, so this picture shows a general scheme for chemical sensors and biosensor, no matter it's a routine sensor or wearable chemical sensors. So basically it has four major parts: analytes, biorecognition element, transducer, and output signal. Okay, so analytes are generally samples, either blood samples, urine samples, and water samples in the case of environmental analysis, and saliva or sweat, and so on. Biorecognition elements are recognition units to provide specificity and sensitivity to the sensing system. So in the case of glucose sensor, glucose oxidase acts as a biorecognition element. And similarly, we have antibodies for immunosensors and so on. And in the case of chemical sensors, these will be replaced by chemicals such as nanomaterials, metal oxides, or other kind of tailored materials. So, and the third component is transducer. The transducer converts the analyte biorecognition element binding event and they translate this binding event into a readable digital signal. So that's the job of a transducer. So there are many types of transducer. We can use optical transducer, fluorescent transducer, or electrochemical transducer. And I'm an electroanalytical chemist, so mostly I use electrochemical sensors. And there are 5 basic parameters are widely used to test the quality of a sensor. So sensitivity, how sensitive the sensor is, how much low detection limit we can reach with our sensing device, and selectivity, because biological system contains several materials. So our sensor should able to capture a particular type of analyte selectively. So that's the challenging part actually. And speed, of course, we want to do diagnostics as quickly as possible. And signal to noise ratio should be sufficient enough to discriminate the signal. And stability, of course, long-term storage stability and even the operating stability also matters. And in addition, the sensor should be cheaper, simple, portable, and point of care. These are necessary from a consumer perspective view and from the market perspective view. So this chart shows top 10 global causes of deaths in 2016. So from WHO database. So the blue bar shows number of fatalities due to the chronic diseases, while red bar shows number of fatalities due to infectious diseases, and the green bar shows number of fatalities due to road injury. So if we see this chart closely, we can get a point that chronic diseases causes more than 70 or 75% of casualties every year than the infectious diseases. But we mostly focus on infectious diseases. We should give equal importance to chronic diseases. And mainly, if you see the first bar, the heart diseases causes around 10 million deaths every year. So that's really a huge number. And what's the problem? And why we have a sophisticated diagnostic tools, laboratory tools, MRI imaging methods, but still we can't save millions of patients. So the major problem is lack of sensor for early diagnostics. So this is the major problem we have for many years, and still this is the problem. And how are we going to solve this problem? There are many methods, and one kind of method is we can use wearable sensors to collect more number of data from people, and using that more number of data and manipulating those data, we can do early diagnostics. So that's one direction where the real-time chemical sensors can give for these early diagnostics. So in fact, people from computer science say data is the new oil, but I think even as it is, data is a new oil in biological science as well. We have to capture a lot of data, analyze the data, and interpret the data and acted upon it. So this slide shows what are the parameters detectable by wearable sensors. So wearable sensors are sensing devices that can be used on our body, that can be weared by a person, and those sensors interact with the wearer's biological system and translate those interaction event into a readable digital signal wirelessly to a wearer's cell phone or caregivers, or wirelessly to the emergency units as well. These can be classified into three major categories. One is wearable physical sensors. The second type is wearable electrical sensors. Third type is wearable chemical sensors. So wearable physical sensors measure physical vital signs such as heart rate, blood pressure, temperature, and how many steps we walk. Like a smartwatch can do that job. And electrical activities are known for many years, like ECG, EEG, EMG. These will measure the electrical activities of our organs, like ECG measure the electrical activity of our heart. EEG measure the electrical activity of brain, and similarly EMG measures electrical activities of muscles. Okay, so these are wearable sensors, non-invasive sensors. And the third category, wearable chemical sensors. This is newly developing wearable devices. There are many challenges with wearable chemical sensors compared to wearable physical or electrical sensors. And we can detect several kinds of biomarkers like metabolites such as glucose, lactate, electrolytes, hormones like stress hormones, and drug abuse. Like actually saliva is a medium, body uses saliva as a medium to expel or to eliminate the toxins or toxic chemicals out of the body. So which means if we have a wearable sensor, we can detect drug abuse, and toxins as well. So we can also measure amino acids, proteins, disease markers, and several cytokines and protein markers. So there are a lot of opportunity in the wearable chemical sensing side. At the same time, there are a lot of challenges also. So let's talk about wearable physical sensors first. So wearable physical sensors monitor physical parameters. Let's say the best example is smartband. Now I think almost most of us use smartband in order to manage our everyday exercise routine. So these smart bands monitor how many steps we walk per day, and in fact we can transform these information into our mobile devices like smartphone or desktop, and those information can be stored for future personalized medicine or personalized healthcare uses. So this is quite useful, and it can measure heart rate, blood pressure, and vital signs. We can also plan for personalized diet based on individual wearers' physical parameters data. So it's quite useful, right? And the other example is a remote healthcare monitoring system for elderly people. So one major problem with the hospital stay is older people, like the elderly people stay longer days in the hospital than the other age group people. So in order to avoid such longer stays, we can use these remote health monitoring systems. So basically these are containing several set of sensors. That sensors can be placed on the body of those elderly people, and these sensors able to interact with the movements and physical signs of the elderly person. And the interaction event can be translated as a digital signal to the family member or a clinician or an emergency unit. Right? So if something happens, some accidents happen, Let's say if the elderly person suddenly fall down or get some kind of stroke or some kind of sudden emergency situations, these sensors immediately collect those important crucial information and transmit those information to the immediate caregivers. So it's quite useful for the elderly people. Okay, and this slide shows a timeline of wearable physical sensors over last 5 years. 5 years, if you see the timeline from 2016 to 2020, the number of wearable devices reaching the commercial market is keep on increasing. And particularly if you see 2019, in 2019 there is a huge spike in number of wearable watches arrived in the market, so which indicating that there is a lot of commercial need for these kind of wearable sensors. People are interested to know about their healthcare personally through at their home convenience, right? So maybe in future we will definitely have wearable chemical sensors that not only monitor physical signs, that will also monitor chemical parameters. Okay, so this slide shows what are the needs of wearable chemical sensors. Okay, one example is cortisol. Cortisol is a stress biomarker. Our body produces cortisol in response to stress. In fact, naturally, our body produces certain amount of cortisol every day. So in the morning time, its production is usually a little bit higher, and over the course of the day, it follows a decline trend, and it reaches a plateau at the later stages of the day. So this is the regular and usual pattern. But let's say if an external condition or external environmental situation induces like our mood, or it makes some impact on our emotional status, then our body produces more amount of spike. There will be a spike in the cortisol production. So in this case, if we use normal sensors, we can only get a few information. So normal sensors collect information at a particular moment. So that's like a snapshot of particular moment. While these wearable real-time sensors can continuously monitor our biological system and continuously measure what's going on with the cortisol hormones. So it can give a more number of data. Okay, so by manipulating this data, we can get a trend line or a pattern, and from this pattern, we can better manage our stress disorders than the routine normal sensors. So that's one unique example of why we need wearable sensors. And this one is a wearable artificial pancreas. So in the case of diabetes patients, their body unable to produce sufficient insulin in order to manage their blood glucose level. So therefore, they have to take insulin injection externally. So like they every day they take insulin injection through externally. But sometimes their body itself produces sufficient insulin, and at that time they no need to take insulin injection. But unaware of this fact, they take injection anyway. That causes overuse of insulin. Okay, so in order to avoid such overuse of insulin, we can use this wearable artificial pancreas. So basically, this artificial pancreas contains two major components. One is continuous glucose sensor, and the another is insulin pump. Okay, so this continuous glucose sensor is in contact with the bodily fluids. It monitor the amount of glucose going on in the bodily fluids. If the amount of glucose goes abnormal level, it triggers the insulin pump and instruct the pump to produce certain amount of insulin in response to the level of excess glucose. So by this way, we can better manage our diabetes patients than the normal sensors. And here is wearable chemical sensors. So this image is from Professor Joseph Wang's group. So this image shows that the recent trends or recent wearable devices that are possibly can be made. So for example, we can keep wearable chemical sensors in contact lens. We can print such sensors on contact lenses, and that will collect information from our tears. Okay, and similarly, we can also make mouthguard biosensors that will interact with salivary chemicals and collect information from saliva. So saliva, basically 99% of saliva is water, but 1% of saliva contains biomarkers. And in fact, several biomarkers are permeating from blood into saliva, so which sometimes reflects the blood state. So we can also call it as a saliva as a mirror of blood. Okay, so by using this mouthguard sensor, we can monitor such important biomarkers. Yeah, and the other most of other sensors are wearable sweat sensors. So most of the wearable chemical sensors, people focus on sweat analytes compared to saliva or tears. So we can make wearable eyeglass sensors, stretchable chemical sensors in socks. We can make sensors with rings in gloves. This is useful in the laboratory settings. And we can also make tattoo-based sensors and other kind of metabolic sensors and ECG sensors. So the ultimate objective is to make several kind of wearable sensors and interface the sensors with our body. So the ultimate objective is to get as much as information possible, so that if we have more information, we can make more better prediction and better judgment. So that's the ultimate objective with the wearable chemical sensors. So mostly electrochemical techniques are used in wearable sensors. The main reason is it's low cost and portable. So compared to HPLC, mass, and routine other things, it's around 20 to 30 times cheaper. And actually, HPLC mass, these are bulky and laborious instruments, so we can't make it as a wearable. So on the other hand, the electrochemical sensors are point of care compatible. So let's see, the glucose sensor is very miniaturized and simple sensing system. All we need to do is just get a drop of blood, place it on the sensing zone, connect to the meter, and you can see the signal. So that's the unique advantage of electrochemical sensor. It's highly simple compared to many other traditional analytical systems, and it can directly convert digital signal, because the electrochemical sensor itself is an electronic device, right? So, but in the case of optical sensors, we need an external optical tool to convert the analyte probe binding event into a readable digital signal. Like in the electrochemical sensor, we don't need any external tool. That's another advantage. So because of these advantages, we can miniaturize the sensor as small as possible. And they are also compatible with non-transparent samples such as blood or saliva. Our biological fluids are non-transparent. And if we want to use optical sensors like fluorescence, we need to have a transparent sample, because those techniques are based on light or lights. So the color pigments interfere with the light. So that causes false positive or false negative results. But on the other hand, electrochemical techniques are diffusion-based phenomena. Here we no need to worry much about these transparency issues. So these are the advantages for electrochemical techniques that makes these techniques as a attractive tool for wearable chemical and biochemical sensors. So nanomaterials in wearable sensors, and one problem with these non-invasive sensors or wearable sensor is the amount of analytes or markers present in these medium are usually very, very low, sometimes 100-fold or even 1,000-fold lower than the amount present in blood. So, which means we need a highly sensitive technique in order to capture such low concentration of these markers. Right? So there comes the role of nanomaterials. So nanomaterials, because of their properties such as large surface area, catalytic activity, and electronic properties, these nanomaterials help us to improve the sensitivity of the sensor. So with the arrival of nanomaterials, we can go like a nanomolar level of detection, even picomolar, or even more deeper. So that's the important uses of nanomaterials in wearable sensors. So in fact, if we see the past few years material science research progress, there is a huge progress. There are several kind of new materials are coming up, like then they can be classified into three major categories: organic materials, and carbon nanomaterials. Particularly carbon materials such as graphene or carbon nanotubes, these are making significant progress over the past decades. So many of these wearable sensors has either graphene or these carbon nanotubes as a substrate to hold the active materials to stabilize those materials. Okay, so and some conditions for nanomaterials to be used in wearable sensors and non-toxic, because we have to use this sensor with a physical body. So therefore, the materials or techniques should be non-toxic, biocompatible, and it should be stretchable and flexible, because our body is constantly undergoing deformation and other bending motion. So the materials should be compatible with these kind of stretching motions. So this slide shows other aspects of nanomaterials. So basically, the major problem in biosensors or in bioelectronics devices is the lack of electronic communication between electrode surface and the active site of a biomolecule. Okay, so because the active site of a biomolecule is or deeply buried into the protein backbone of the backbone of a protein or enzymes. Okay, because they want to preserve the secondary or tertiary structure in order to maintain enzyme activity or protein activity. So that's the challenge with the biosensor. And how can we resolve this issue? Nanomaterials help us to resolve this issue. So nanomaterials are kind of mediators. They shuttle electrons between electrode surface and the active sites of biomolecules. Let's say the nanomaterials can pick up electrons from electrode surface, and they can trap on the active sites of protein molecules. At the same time, they can pick up electrons from active sites of biomolecule, and they can drop at the electrode surface. So these are quite useful to enable to make electronic wiring between electrode surface and biomolecules. So this is really important to make wearable biosensing devices. So this slide shows some examples for wearable chemical sensors that target sweat analytes. So let's see that this is a fully integrated sensor developed by W. Gao et al. And they developed this fully integrated sensor, which is almost equivalent to a smartwatch. But this monitor chemical parameters, not like physical sensors. They monitor physical parameters. They use photolithography technique in order to pattern the active materials onto the electrode surface. They use PET because PET is a flexible substrate. So they pattern these active materials like carbon nanotubes, chitosan, Prussian blue modified gold electrode in the case of glucose and lactate. And they use glucose oxidase for glucose sensor, while lactic oxidase for lactate sensor. So these are the routine enzymatic sensors used for glucose and lactate sensors. So when our sweat releases glucose or lactate, these sensors interact with such markers, and glucose or lactate can undergo oxidation reactions. And because of this reaction, there will be an electron transfer process. And by monitoring the rate of electron transfer, we can detect or quantify how much amount of glucose or lactate present into the sweat or released into the sweat. Okay. And they use ion selective electrode for potassium and sodium ionophores. They use P.PSS as a supporting medium to immobilize ionophores. And they also have a temperature sensor. So it's a multiplex sensor. We can measure simultaneously multiple parameters, which is really useful in the healthcare monitoring applications. So here temperature sensor plays two roles. One, the temperature sensor itself useful to continuously monitor our body temperature, and the second purpose is temperature sensor acts help the sensor to calibrate their readings, because the sensing parameters are depends on temperature. So we need to correct the temperature related errors, so that the temperature sensors serve for this purpose also. Okay, and these data can be translated wirelessly into a cell phone device, so we can actually see how much amount of glucose or how much amount of lactate is released in our sweat. So by this way, the wearer can better manage his exercise routine or his diet routine. So it's quite useful to manage our health. And this wearable sensor is developed by KAUST researchers. So they use MFT-based wearable patches. They so basically, this patch is made up of carbon fiber membrane, and they use CNT, carbon nanotube, MXene, titanium carbide, Prussian blue. These has active materials, and coat these materials on the carbon fiber membrane and use this as a sensor to measure glucose, lactate, and pH. So Prussian blue is actually a mediator, so it can collect information from the enzymatic reactions and transfer those electrons to the electrode surface. So they use electrode apposition and the screen printing methods. These are quite well known and cheaper methods. They also use microfluidic channel, because in order to control a low volume of samples, we can use microfluidic channel. And they use open circuit potential for pH monitoring, while chronoamperometry for glucose and lactate. So they measure the amount of current with respect to the concentration of glucose and lactate. So these two examples show the importance of wearable chemical sensors targeting sweat markers. So of course there are many other kind of sweat biosensors, but these two can be model examples. And this slide shows some examples where the wearable sensors targeting saliva markers. Okay. So saliva is actually a very useful non-invasive fluid. Is available all the time, and it contains a lot of parameters. If you see the saliva, it contains infectious disease markers, metabolite markers, chronic disease markers, drug markers, and so on. So currently we have many sophisticated techniques like microfluidics, smartphone technology, flexible devices, wearables. So because of these recent techniques, we can achieve such low detection limits, and we can monitor saliva markers. Okay. So this one is one example. So mouthguard sensor for uric acid. JK Metal developed this wearable mouthguard sensor. So what they did is they use a screen printing method. They use PET because it's a flexible substrate, and they use graphite, Prussian blue, bovine serum albumin. Use this material as an immobilization matrix for uricase. Uricase is a enzyme for uric acid. So when our saliva produces uric acid, then it will interact with this sensor. The uric acid oxidizes uricase oxidizes uric acid, and that will initiate an electron transfer process, and those electrons will be transformed or transferred by Prussian blue to the electrode surface. By this way, we can make a chronoamperometric sensor and correlate with the amount of uric acid secreted in the saliva. Okay. So this interesting mouthguard sensor, so they can pattern print the sensor on mouthguard, and quite simple, and it's a portable sensor. Okay, so Not only they use electrochemical sensor, they also assemble potential state, microcontroller, Bluetooth transceiver, all these devices into a portable small chip. Okay, that's the advantage of electrochemical techniques. We can miniaturize all the components into a small system. Okay? And the advantage of this sensor is they can wirelessly transmit the information to our electronic devices, consumer electronic devices like smartphones, laptops, and so on. And we can use those data for a diagnostics purpose, or we can store the data for future personalized healthcare or any other future diagnostic purpose. Okay. And this is another kind of wearable sensor for saliva markers. This one is developed by Joseph Wang et al. Okay, so basically there is a problem with the neonatals or newborns. We can't extract too much blood from newborns for analysis. So in order to resolve this issue, these researchers make a fully integrated pacifier sensor. So what they do is they screen print the electrochemical sensors on the pacifier as a portable sensor tool, and so that sensor is in continuous contact with saliva of a baby. Okay, so automatically it collects non-invasively the how much glucose is present in the saliva. So it monitors glucose, but in fact this also can be extended for other kind of biomarkers. Okay. So one interesting thing is because the newborns, the baby's mouth is keep on moving, and it automatically stimulates saliva pumping. Okay, because saliva sampling is one issue in normal saliva sensors, but in this case, the automatically it stimulates saliva pumping. Okay, so these two are examples for saliva markers, and of course we also can make wearable chemical sensors targeting tear markers. So Park et al. Print some sensors in the contact lens, and they also print antennas, rectifiers, and all the electrical and wireless communicating platforms, so that we can get the information in our cell phone. And this slide shows some of the major techniques used in wearable chemical sensors. So like microfluidics is mostly used in these wearable chemical sensors because in wearable platform we are talking about very low volume of analytes, low volume of fluids like a microliter or even nanoliter of sample. So in that case, microfluids are quite useful because microfluids can be used to tune or to process such low volume of samples. And smartphone technology, because people are always interested to know what's going on with their body. So if we connect all these wearable sensors, interface with the mobile phone, they can visually see what's going on in their body, and then they can manage their diet routine. Right? So wearable sensing community is mostly interested to make wireless sensors, and this is almost like a requirement. And the sensor materials or sensing electrodes should be stretchable, flexible, and bendable. As we see in the early slides, our human body is a soft and curved body, so we cannot use traditional rigid electrodes. Those are incompatible with our body. So therefore, any materials or any substrates we use should be stretchable and bendable. And major printing techniques used in making these wearable sensors or screen printing techniques, and inkjet printing, and even 3D printing, or simply electrode deposition, So these are the widely used printing techniques to print the nanomaterials or biomolecules onto the flexible substrates. So when application of wearable sensor is personalized medicine. So personalized medicine is a currently popular term in medical among medical community. So generally, current medicine we use one treatment fits for all approach. So basically, let's say if 7 patients are diagnosis with cancer, like the colon cancer, we go for same therapy for all 7 people. Okay, like let's say chemotherapy, we go for a same kind of therapy for all 7 people. But in fact, the research shows that this same therapy will only work for 3 out of 7. Okay, and the 3 out of 7 will not have any effect with this treatment, and one, in fact, has adverse effect. So this showing that the current medicine, the generic medicine, work even less than 50% of the total population, the tested population. And so this is really a big limitation of current generic medicine. So let's say another example, if we say around 10 patients go to see a doctor reporting that they have a fever, and immediately doctor prescribe a fever medicine, let's say paracetamol, for all 10 people. But maybe the only paracetamol work for 5 people. It maybe has no effect for 3 people. Like we need to prescribe other kind of fever medicine, and for two more people, different kind of treatment. So that's the limitation with the generic medicine, because that doctor don't have enough information. He only knows the patients have fever. He don't get know any personalized information about that particular patient. So that's the gap in the current medicine. And future medicine is moving towards more personalized diagnostics. So personalized medicine is kind of tailoring the medical treatment. So we can categorize and we can separate people based on their individual biological pattern, and after categorizing we can go for treatment depends on the parameters of the each category. So let's say these 7 people categorized, diagnosed with cancer patients. So imagine that we have all of their individual personalized data, and we can separate these 7 people into 3 groups. First three into one group, and second 3 in another group, and then the other one is in the third group. Depends on their personalized data. And now we can go for treatment. We can choose which kind of treatment is suitable for this group and for second group, and so on. So this really interesting, right? We can make almost see we can make a successful treatment for all the patients. But what's the problem? The major problem is how are we going to separate these groups? So in order to do that, we need a lot of data, a lot of personalized data of the individual person. And there comes the role of wearable chemical sensors. So these wearable chemical sensors continuously interact with our body, collect our physical information, chemical information, and we can store those data in our personalized devices, and then we can use those data for personalized medicine. So that's one unique advantage of real-time wearable sensors. And to further understand these things, let's say another simple example. Let's say around 10 girls want to purchase some clothes for them. They go to a clothes store, and some of maybe five out of 10 want to buy saris. 3 girls want to buy chudidars, and the 2 girls want to buy t-shirt. Okay, so this but let's imagine the seller telling them that no, you all should buy saris only, right? So it doesn't make sense. They are allowed to buy dresses, depends on their need, depends on their interest, right? So in the same way, we can't use a generic medicine for all the people in the data set. We can use personalized data and group them based on their parameters, and then we can go for treatment. Okay, so that's the advantage of personalized medicine. And in fact, we everybody use YouTube. If you see the YouTube, they collect data from us, and using the data we give to them, they make personalized video suggestion for us, like based on our likes, based on our comments, based on our subscriptions, based on what we type in Google. All of them are information. So they collect all these data and they use artificial intelligence tools, and then they make some kind of predictions, and they understand our needs. Okay, so from our, so actually they can sense our our personality. Actually, they can smell our personality. So based on our personality, they suggest personalized videos to us. So it's really one interesting thing to understand how these large data can be used to make personalized things. So like sometimes I say like Google should pay for us because we generate the data, we give data to Google. Whatever we type, even a single letter or single word, whatever we do with Google is we are actually indirectly working for Google. We are indirectly giving data to Google, and because of the data we give to them, they are making these apps, and they're making these things. So actually, they should pay for us. And another example is in retail stores or multinational companies also use large amount of data to make personalized products. So these are actually these companies or retail stores using these personalized products for longer years, even like 20 years before. So how they do, they like, we when we go for retail store, we have our personal card, or like a card for each store. We have our own card, right? We give our phone number, and in that account they store our purchase history. So our purchase history is the data. With our purchase history data, they able to predict what we are going to buy in the next time. So they can predict our buying pattern. Okay, so once they predict our buying pattern, they can target us to buy more. They can suggest us, so they can suggest us what are the products we are interested. Like they can send us some kind of which coupons about some products which we are interested. Actually, even we don't know that we need that product, but that company knows before we like it. So that's the interesting and also terrible part with the data-driven technology. So I would like to share one story with the story which I read in a book called The Power of Habit, written by Charles Duhigg. Uh, in that book, he mentioned about habits, and he mentioned about one story, okay, a story of a family of a father, mother, and a teenager girl. So they have an account in Target. Target is a retail store in US. So they usually buy, which means they use their card to buy. So Target knows their purchase history and what they are purchasing every month, or whenever they purchase, they store this data, and their analysis, their analytical people or analytical techniques automatically monitor what they are purchasing and interpret the data and then suggest the coupons. So one time the Target company send out some kind of clothes for newborn babies to this family. Okay, so they send these coupons to the family, and the father feel really shocking because they don't have newborn baby. In fact, nobody is pregnant in his family. So he called the Target company and talked to the manager. why are you sending these kind of useless coupon to me? I don't have any kids, or no kids are coming up to my family. And the manager checked their data. Actually, as per the data prediction, they have to send this coupon to that family. So that's their data science telling them. So anyway, the manager apologized for that event, and then they hung up the phone. But within few days, after a few days, the father called the same manager and tell him that I'm sorry, actually my teenager girl is pregnant. So which indicating that actually target knows what's going on in his family even before father knows it. So that's the beauty of data, and also that's the terrible part of data. So we can use these data for in both way. It's like a double-edged sword. So that's the interesting story of from personalized product side. So summary. So back to the summary. It's early diagnostics is still major challenge in healthcare monitoring. Normal sensors cannot give much information, so we need to use this kind of real-time wearable sensors to generate data. And the wearable sensors can give a lot of data, and those lot of data can be used for early diagnostics. For example, if I have a if a doctor has a wearable if a doctor has a heartbeat data of a particular person for 3 years heartbeat data of a particular person, then the doctor can using artificial intelligence or IoT tools, he can interpret those large amount of data, and he can generate certain patterns, and from that pattern he can predict that whether that person is susceptible for heart related diseases in the coming years or not. So this is really interesting because we can predict even before the heart diseases starts. Okay, so but we need data, we need more amount of data. And another example is cancer. If there are many cancer markers released in our sweat, saliva, so if we have a cancer marker related data over the course of 2 years or 3 years, with that large amount of data, we can create a data set and make patterns out of it. And from that pattern, we can predict whether whether that person is susceptible to get cancer in the coming years. So this is really interesting because prevention is better than cure. We always say that. So these real-time sensors can be one of such tools to have these kind of early predictions. Okay, more precise the evaluation, and doctors can make better judgment. And these all wearable sensors targeting on non-invasive fluids. We mostly target sweat, saliva, and the tears. So we don't penetrate into the skin, so which is one good thing. Particularly, it's quite useful for neonates and older people because those are the vulnerable age groups. We can't get too much blood out of their body, so we can use these kind of non-invasive sensors. We can also go for distance diagnostics because all these data can be transmitted wirelessly into our electronic devices. Real-time physical sensors are already reached the commercial market. We already use wearable smartwatches, and in the coming days, wearable clothes, wearable smart earphones. They can detect some kind of physical signs. So many kind of physical sensors are coming up in the subsequent years. Chemical sensors are yet to be commercialized, but the recent studies showing that great promise, and definitely there will be at least few number of wearable chemical sensors will be in the market in the coming years. So these sensors not only monitor physical signs, they can also monitor our chemical parameters by interacting with our biological systems, biological markers. So nanomaterials plays a huge role. Microfluidics is important to manage small volumes. We should interface with smartphone, and we need flexible materials. And this data can be used for personalized medicine, and it really has a huge opportunity to change the way of our current disease diagnostics, and has a potential role for future health monitoring. And managing large data is really important, but with the current advancement in the computer science technology, I think it's not a big deal. We can store the data in cloud settings, we can use IoT or AI tools, we can store those data. But the problem is data security. As we talked in the previous slide, data can be manipulated. So we don't want to disclose our personal data to other people or to a hospital unless we want to get some kind of treatment. So data security will be a huge issue. So that has to be taken into consideration. So these are the summaries, and thank you for your kind attention. And if you have any question, please feel free to ask.
Thank you, sir. Thank you for a wonderful presentation. The forum is open for questions. Any questions? So, good morning, sir.
Yes, yes, yeah, please.
Sir, you have shown two different type of glucose monitors, sir.
Yeah.
Like one is through saliva, another one is artificial pancreas, which is
Yes.
also going to monitor the glucose level.
Yeah.
So, can you able to tell what is the mechanism behind this puncture-free glucose monitoring system, sir? Generally, in biochemical monitors, we are going to puncture our skin and we are going to be take the blood out and we are going to monitor
Mhm.
the glucose level. So, how these two are differed and how they are calculating the glucose level, sir?
So basically, the sensing mechanism is same in all type of glucose sensors. So we in all these sensors, they use glucose oxidase as a enzyme, that is a biorecognition unit, and they use some kind of nanomaterials as a supporting or immobilization matrix. So the fundamental sensing principle is same, but for normal glucose sensor, we can use solid electrode. That's fine. For artificial pancreas, if we want to go for minimally invasive, we need a highly biocompatible material. So the materials and the substrate vary, but the sensing principle is the same. We go for a normal amperometric sensor. Mostly they measure current. So there is no difference with sensing principle. Only the materials and the substrates changes.
So nowadays, wearing sensors like through smartwatch has become a fashion.
Yes,
Like most of
yes,
the people, even younger or older people are wearing, and they are each and every stuff they are watching. So,
yes.
like this have any impact on their health, sir? Like heartbeat, everything they are monitoring throughout the day. Any
Definitely,
health impact is
definitely.
there, sir?
Yes, definitely. There are studies indicating that because of these, because people when they use these smart watches, they have more health conscious. Like we can fix the number of steps we can walk per day, like 8,000 steps. So they can fix it, and if over the course of the day they see that their number of steps is less than 5,000 or less than the threshold, then they force themselves to take more steps, right? So the studies proven that these wearable watches, or maybe some people use it for fashion, but they really has impact on the healthcare monitoring that drive the people to take more physical activities. So in fact, even me uses these things like that motivate me. So it's kind of motivation. Those devices are motivating us to go for extra work, to take extra steps. Right. So that's the purpose of wearable sensor. So it's kind of user friendly.
Okay, sir. You have told about the measurement of cortisol, measuring that hormone which is responsible for mood elevation. So, can you hear me?
Oh yes, yes, yeah, I'm listening. So
Yes, sir.
we talk about cortisol, right?
Yeah, cortisol. Yeah, cortisol measurements.
Yes,
So,
because yeah.
yeah, what is the mechanism behind that, sir? Like,
um,
how we can relate that cortisol into that mood elevation, sir?
Okay, so again, we can use electrochemical sensor in the sensing perspective. Mostly for cortisol sensor, we go for immunosensors. In fact, in our lab, we developed one cortisol sensor in few years ago. So we can use mostly the current method is immunosensors. We can also prepare molecularly imprinting polymer based sensors. So these are the sensing principles, right? So these sensors are basically based on electrochemical signal readouts. So our sweat has certain amount of cortisol. So our saliva has is producing stress hormones like cortisol or even other kind of hormones. Okay, so the sensing principle is basically electrochemical sensors. Okay, but as again, only the electrode fabrication varies with the normal laboratory analysis and with the wearable analysis. So I think you're asking what kind of methodology, right?
Yes, sir.
Yes, so they use electrochemical immunosensors or electrochemical molecularly imprinting polymer. So those are the routine techniques used for these cortisol sensors. So they usually have antibodies specially made for cortisol. They immobilize those antibodies with the help of nanomaterials on the electrode surface, and then you interface this sensing system with the on-body things.
Sir, and there is one more clarification regarding the wearable mouth guard, sir.
Okay.
Yes, sir. You have told it have Bluetooth, and it is going to be transmitting data.
Yes.
So how it is generating electricity, sir? Whether we have to keep any batteries or any internal mechanism to generate an electricity to
Oh, yes,
transmit.
yes. So actually, I missed to include that information. So that's one kind of issue, and thank you for pointing out that. Actually, there is we need energy source, right? We need to keep a battery, a short, small battery. So that's necessary in order to, because these are electronic devices, we need to give power to them. So we have to use wearable powering devices. That is also an interesting research topic. People from energy research, people who are working in energy sector, they develop miniaturized batteries, miniaturized supercapacitors, or miniaturized fuel cells or enzymatic cells for wearable sensors. So that is also one ongoing interesting research topic. So currently we have several uh, miniaturized battery resources, but still there are huge challenges. Yes, we need such miniaturized batteries in order to let these wearable sensors operate automatically. Yes.
And you have told about the precision medicine, like individualized medicine.
Yes. Yes.
So what is the role of that sensors in the individualized medicine, sir?
Oh, yes. So this in precision medicine, what we need in precision medicine, we need data. We need a lot of data, right? We need, for example, if I want to go for precision medicine, I should give more data to the doctor so that the doctor can understand about my physiological system. If I want to, and for example, if I go to a heart doctor and want for precision medicine, I need to give my heart related data, right? So how can I get these data? There are many methods. Wearable sensors is one method that help us to collect more personalized data. For example, you say you talk about wearable watch, right? So if I wear watch every day for last like continuously for 3 years or 5 years, and those data can be automatically stored in my cell phone or in cloud, so I can have a huge set of data about my heartbeats over past 5 years. So that is the data, right? And that data can be used for the my future heart related issues. So there comes the role of wearable sensors. So these wearable sensors help us to generate more data, and these more data is used for personalized medicine. So still these are in the beginning stages. I think you guys, pharmacy students, aware that personalized medicine is currently hot topic. It still is in the early stage, but I think these wearable sensors will have a significant role in personalized medicine. As I mentioned, in the other sectors like even in the corporate things or in Google or YouTube things, what they do, they collect data, right? Once they have data, they can they can do whatever they want. They can predict anything about us. They can predict our type. They can predict our personality, right? So similar way, we can get more information from our wearable sensors and use this data to predict about our physical, I mean, our health personality. Let's say, yeah, health personality, something like that.
Thank you, sir. Any other questions?
Thank you, Dr. Veerappan, sir. Thank you, sir.
Oh, yeah, thank you.
Thank you, sir. We had a wonderful and informative presentation, sir. I hope this interaction will motivate the students and encourage them in active learning in the forthcoming days. So, on behalf of our management of AKCP, hereby I express my wholehearted thanks to you and your esteemed university for such a wonderful and informative uh, interaction about the. Can you hear? Can you hear?
Yes, yeah, I'm listening. Yes, I can
Yeah.
hear.
Yes. Variable chemical sensor for healthcare monitoring. So some seeds of intelligence in our students. Thank you, sir. Thank you, sir. Thank you so much for your wonderful support. Whenever would like to plan to Tamil Nadu, sir, please let me know, sir. We will invite our institution, sir.
Sure. Thank you for invitation. In fact, I'm glad to be a part of this event. So I'm glad. So in future also I can make my contribution. Sure.
Sure, sir.
Thank
Let's
you.
have a good collaboration, sir. Let's have a good collaboration in future also.
Okay. Thank you.
Thank you, sir. Another one more final request, sir.
Yes.
Please refer, sir. Kindly refer your friends or colleague for our future webinar who are able to guide and support and help towards the development of our students' career, sir. International speakers, sir. Kindly refer, sir. Your friends or colleague.
Sure. Yeah, I will. Yeah, I will refer. Some. Sure.
Thank you. Thank you so much, sir. Thank you so much.
Thank you. Bye.
Take care, sir. Bye. Take care.
Okay. Bye. Take care.